Good morning, everyone. My name is Scott LaGanga. I'm Executive Director of the Partnership for Safe Medicines. I have the great distinction of working and running PSM on a day-to-day basis, but largely due to the Board of Directors that the partnership has had since its creation nearly a decade ago. I'm delighted today to welcome you to the second annual interchange. In many respects, we weren't sure if we were going to have a first one, so it's pretty good to get to number 2 in the end. But we were quite excited with the output feedback and the discussion last year that we felt it only important to actually have a second one and to expand it. So for those of you who were here last year, the room was slightly smaller, a little more cramped, and there was no tables. So we figured we'd give the opportunity for people to actually have coffee and enjoy the time here, make it a little longer and even and definitely a lot better. So we're very excited, and thank you everyone for joining us. Last year's event, we gathered thought leaders and stakeholders that represented many sides of the unsafe medicines debate. Our conversation, our panelists focused on who the players are, who benefits from these types of activity, and the role that the FDA and law enforcement play, how the media influences that debate, and most important, the perspective of the patient, which is what we always need to come back to in terms of these discussions. It was an opportunity to further define the issue and set the stage for the specific actions we can all take collaboratively. This year, we are here to advance the discussion and focus on what we can do to combat the public health issue, and we're extremely excited about the lineup that we have. As many of you know, this issue, and both of counterfeit substandards and what we simply define as my friend Bijan Misra has taught us over the course of time with PSM India, there's a discussion about safe and unsafe. This is not a conversation about all the definitions and technicalities, but literally of a quality product or a non-quality product and its effect on the patient. Utilizing data, working with our folks and our colleague and board member Tom Kubik from the Pharmaceutical Security Institute, we saw the reports that in 2010 there was a 2.5% increase in the pharmaceutical crime incidents, which include that of counterfeits, nearly 1,700 last year. Looking at that with over 200 of those occurring within the U.S. market. And the recent press and studies have highlighted how counterfeits are contributing to the worldwide issues around drug-resistant strains, particularly around substandard products. For those of you familiar with the issue, you know these imposters may look the same, feel the same, just very much as a legitimate product, often defrauding the consumer of what they believe they are getting or deserve. Drugs are often manufactured in very unsanitary environments and very challenging components to those products in the end. But more and more, the goal of a counterfeiter is not to kill a patient. As we all know, that's bad business. The goal is to create a product that in many ways makes the patient feel better. And so the counterfeits are becoming much more sophisticated. The quality is increasing, which just means it may not be including all the items that we have always heard the horror stories about, but it may not have the active ingredient necessary to actually help the patient in the end. The good news is that collectively we're making progress. As Tom has reported in the PSI report, there are nearly 1,200 arrests last year related to this type of activity. And we hope that here today we can help together fight this public health issue with this type of discussion. For those of you who aren't familiar with PSM, it's a collaboration of more than 65 organizations working together to help educate patients, policymakers, and healthcare practitioners about the issues around unsafe medicines. Our vision of the world is where a legitimate supply chain is free from dangerous counterfeits and no one should fear receiving a medicine of what is included in it. And that's an issue that we sometimes take for granted here in the United States, but our colleagues around the globe do not. And that's something that we often need to be reminded of. Over the last year, we've made significant progress by educating new audiences and constituencies about these issues and building upon our efforts. Our efforts have ranged from partnering with member organizations to educate their constituents, such as our work with our Guardian Award winner last night, the National Association of Boards of Pharmacy. We were very excited that Scotty and the team from NABP could join with us then. Our groups like Men's Health Network, the Association of Nerds in AIDS Care, groups go on in terms of really focusing on this and making it more of a priority. We've created resources such as our new adapted safe sourcing guide. All of these materials are actually available on the thumb drive that came with your profile book and your agenda for the day. Briefing legislators and policymakers, we're very excited. In a minute, I'm going to introduce Congressman Matheson, and we have a video with Senator Bennett as well, which really highlight the intimate relationship that members of Congress are starting to focus on this issue even further than what they've done over the past, which Congressman Matheson has been a testament to the long-term focus on this effort. And expanding our message globally. We often, for those of you who are Americans, you focus only on the US market and we forget about what occurs in the global market. And more importantly, that global market affects the US market. And so our efforts, particularly in areas such as China, India, and Bijan will speak later with a fantastic video that they've worked on, Thailand, South Africa, are beginning to pay dividends in terms of this public health education. And I'm excited to hear from a number of our international colleagues who have come a great distance to focus on this. Today, you'll hear firsthand from these experts, government officials, and advocates. And the interchange is the opportunity to share thoughts on how we can unite in this fight, whether we can work as nonprofit organizations, pharmaceutical companies, government agencies, and advocacy groups. We must all work together to protect the patient. It is a crisis we must tackle, and it's a crisis we must win. Our panels today will focus on three main topics: protecting our medicines, combating drug counterfeiting and sales, and lastly, the role of patients and healthcare professionals. Before we get started, I'd like to thank all of you for participating in this important dialogue, and especially our interchange speakers, some of which have traveled a great distance. I know Bijan may fall asleep in the front row, as this is not the right time for him to be having breakfast, since India, this would not be breakfast time. We are grateful especially for ICE Deputy Director Kumar Kibble, who will be joining us to share his thoughts in our keynote address this afternoon, which we're very excited about, particularly based on the work that ICE has been doing for many decades in this area, and especially at our lunchtime speaker with Undersecretary Hormats. I'd also like to extend our gratitude to the sponsors of the Interchange 2011. We would certainly not be able to do this event without their help. It's good to see there's more than there were last year. That's always a good sign when you're trying to fundraise for an event, and we're very excited about it and hope for even greater success in the future. Lastly, outside, you'll notice there is a signing wall, as well as a video opportunity. And what we've done this year is an effort called our Safe Medicines Means. And the idea here is to actually sign the signing wall and provide your thoughts on what it is that Safe Medicines means to you. And we're developing a video a compilation that we're going to be putting up on the PSM website to really showcase what this means to everyone from a varying perspective. So please step outside during the breaks. It's right outside through those doors, and you'll be able to do that. We'd like to lastly start off with today's interchange with remarks from two members of Congress who have been leaders in this front. Unfortunately, congressional calendar doesn't allow the Senate and the House to be here at the same time, but we're actually quite excited. Senator Bennett was able to provide a video for it, and then I'm going to introduce Congressman Matheson following. Colorado Senator Michael Bennett believes that existing laws and regulations for Americans from potentially deadly counterfeit drugs needs to be strengthened and protected, all with the focus on the patient. A member of the Senate Help Committee, Senator Bennett is calling on Congress to give the FDA the regulatory authority and power to keep counterfeit drugs out of the United States, establish harsher penalties, and develop a uniform drug monitoring system through the Drug Safety and Accountability Act, S-1584, which was reintroduced earlier this month. Earlier this year, Senator Bennett also introduced the Safe Doses Act, S-1002, which aims to provide law enforcement with the tools they need to crack down on criminals stealing from prescription drugs.